Seizures and drowning are two of the most common calls for pediatric emergencies. Cronkite News reporter Bella Hoffman shares more on an event hosted by Phoenix Children's Hospital for first responders to stay up to date on training for pediatric emergencies.
Pediatric 911 calls represent fewer than 5% of all emergency calls. This symposium was created to make sure that Arizona's first responders have the right knowledge and tools to provide life-saving care, especially for scenarios that require a different approach when it comes to children.
This event was made possible by a $250,000 grant from the Phoenix Suns.
Kids are they're kids, so they don't present exactly the same way, and every stage of development is differently. So, you know, a 3-year-old might have a vocabulary, but they might not be able to say that they feel short of breath or have difficulty breathing. They might say that their mouth feels funny or their tongue feels funny. They might use words that you're just less familiar with.
Continuing education, also known as CE hours, is a requirement for doctors, nurses, paramedics, and EMTs in order to maintain their certification. The Phoenix Fire Department requires 80 hours of various CE training per year. Educational training like this symposium counts towards that requirement.
We have over 200 firefighters from the Phoenix Fire Department here, and this is really a fantastic event. It's a really great example of a public-private partnership where we're able to get our EMTs and medics up to date on the latest and greatest in the field of pediatric emergency care.
Medical technology like the Stryker chest compression system can deliver high-performance chest compressions with less strain, micromanagement, and risk. Every second counts in an emergency. Phoenix Children's is proud to serve as the communication hub for pediatric emergencies, providing guidance to first responders in the field regardless of the patient's final destination. In Phoenix, Bella Hoffman, Cronkite News.
The emergency department at Phoenix Children's Hospital is verified as an advanced life support-based hospital for pediatrics by the Arizona Department of Health Services.